soaps and sanitizers, exposure to the powder that's added to the gloves. The chemical sensitivity dermatitis, or allergic contact dermatitis, causes a delayed hypersensitivity reaction from exposure to chemicals added to the latex during the harvesting, processing, or manufacturing. These chemicals cause true allergic reaction, similar to those of poison ivy. If any of you have had poison ivy, you can relate to that. As with poison ivy, the rash usually begins 24 to 48 hours after contact and may progress to oozing blisters or may spread away from the area of the skin that touched the latex. So once you get that on your hands, it can possibly spread to other areas on your arm. The latex allergy, or an immediate hypersensitivity reaction, is a true allergic reaction caused by certain protein in the latex. Latex allergy can be more serious than either irritant contact dermatitis or allergic contact dermatitis. The proteins may cause sensitization, which means the worker has a positive blood or skin test for the latex allergen, either with or without symptoms. So you can have a latex allergy and really not be aware of it, and all of a sudden it can react at the constant use of the gloves. Reactions can occur within 10 minutes or hours of the latex exposure and can range from mild symptoms such as skin redness, hives, or itching, runny nose, itching eyes, scratchy throat, asthma, and possibly collapsing, as I said before. Reactions are similar to an allergic person being stung by a bee. Who is at risk for latex allergy? Persons with ongoing latex exposure are at the greatest risk for developing latex allergy. So healthcare workers are right on the top there because we are continually washing our hands, changing our gloves, putting new gloves on, changing them again, where our hands become dry, irritated. Studies indicate that exposure early in life and your total amount of exposure are two important risk factors. Healthcare workers who frequently use the latex gloves and other latex-containing medical supplies can help cause this to happen sooner. A lot of the products in the medical field do have latex in them, catheters and different things like that. If you have an allergy to avocados, potatoes, bananas, tomatoes, chestnuts, kiwi fruit, and papaya, these fruits and vegetables are associated with latex allergy, so you want to be extra careful. How common is the latex allergy? Recent studies indicate that from about 1 to 6% of the general population have a latex sensitivity. Of the 7.7 million healthcare workers in the United States, about 8 to 12% are latex sensitive. That really is a large amount of people. What you want to do is encourage your employer, and it is required actually by the regulations, that they must provide you with a non-latex glove and materials to use in your job. So if they have not done that, it is your right to request that. Also, if you do use latex gloves, you would want to use the gloves without the powder, because the proteins in the powder can cause the latex to stay on your skin even after washing and cause you to have a problem. Currently, there is no specific cure for latex allergy. We have only prevention, avoidance, and the treatment of symptoms. Once workers become allergic to latex, special precautions have to be taken, as I've previously said. But you also have to remember that those precautions have to be also taken in your home and out of the workplace. Although certain medications may reduce the allergy symptoms, complete latex avoidance is the most effective approach. The facility you work in has an obligation, again, to provide you with non-latex gloves for your use. NIOSH, which is the National Institute for Occupational Safety and Health, has developed recommendations that you and your facility where you work can follow to minimize or even prevent the health problems related to latex allergy in the workplace. For your own protection, become familiar with the following recommendations. Promoting good housekeeping practices to remove latex-containing dust from the workplace. Providing educational programs and training materials about latex allergy. And periodic screening if you are at high risk for latex allergy symptoms. You can take the following steps to protect yourself from latex exposure and allergy in the workplace. Number 1, use non-latex gloves for activities that are not likely to involve contact with infectious materials. 2, if you choose to use latex gloves, use the powder-free gloves. 3, do not use oil-based hand creams or lotions when wearing latex gloves. This breaks down the protein in the gloves and can cause you to have a larger reaction. After you're removing your gloves, always wash your hands with soap and water and dry thoroughly. And number 5, try to learn as much as you can about latex allergy through any employer you may have. Latex allergy is a real problem for healthcare workers, and you can help stop latex sensitization by following the recommendations that have been discussed here. I hope you've gained some valuable information about workplace safety issues. Thank you for watching this video, and good luck with the rest of your training.